Good evening, everyone, and welcome to the 2087th daily webinar series of the International Forum for Promoting Homeopathy. I'm Arya. I'm a third-year student from Adurashramam NSS Homeopathic Medical College, and I'll be your moderator today. Today, we are greatly honored to have with us Dr. RAMADEVI AMBADI, a highly respected clinician with more than 5 decades of rich clinical experience, renowned for her expertise in managing infertility cases through homeopathy, a recipient of several prestigious recognitions, including the Swami Adiradas National Award 2021. She has inspired generations through her dedicated service and clinical excellence. On behalf of the IFPH, I warmly welcome all participants to this webinar. And today's session on management of infertility with homeopathy promises to be an enlightening academic experience enriched with valuable case presentations and practical insights. We welcome you, ma'am.
Thank you, Arya. Can you hear me?
Yes, ma'am.
Can you hear me?
Yes.
Okay. One thing I want to ask, is there anybody who had attended my previous online or offline classes? If so, please excuse me. I am telling the same thing now because I was on a pilgrimage tour from 27th to 17th. I came back 17th only. I was so tired. And Dhanesh asked me to take class today. Then I could not tell no to him. That's why I took the class, and I am telling. What I know now. I remember. I want to ask you about it, whether I should tell about infertility in general, or about my successful cases, or about how I treat that, how I got more than 50% result treating the infertile couple who approached me. What I want to tell.
Yes,
Tell me.
we can go ahead with the case presentation because case presentation that automatically come with the case studies and material medical also. So we can what are the prescriptions, how you move forward, and what are the things you usually get, and where you struggle. All these things can be discussed.
Okay. Can you hear me?
Yes, we can hear you.
Okay.
Your network
Can
is
you see?
your network is little bit low.
Yeah, that's right. That's why I'm asking. Here, heavy rain. I told you, no, don't think that those who are participated in my previous classes don't think that I am telling the same thing. That is Charvila Charvanam. That means I am telling the.
No problem.
I am
No problem. We have new
chewing
people today.
again and again the chewed ones. So please excuse me. I'm going to tell what method I have received during my treatment. Okay. These infertile couples, no, they are not, who are approaching us, they are not patients. They are not sick. They are heart sick. Because, see, as a human being, as a living body, living being, we have got three cardinal principles. Can you hear me, Lanesh?
Yes, ma'am.
And, can you see me?
Yes. No.
No, ma'am, we can't see you, but we can hear you.
That my network is very slow, I think.
No, you
See,
can go ahead.
I guess, ma'am, please try starting the video.
Even
it
without
is
video,
not,
even without
not
video, you
working.
can talk. Even that's because of low broadband. So you just go ahead with speaking. Automatically, the video will come. Okay.
You hear me?
Yes. You
Yes.
may talk. You may talk.
Okay. I could not see anything. That's why I am telling. I am asking. See, three cardinal rights of a living being is birth, growth, that existence and reproduction, and death. The first is already happened. Okay, we are born. The last is definitely happened. We will die. Then the second one is growth. that is existence and reproduction. If it is banned, we naturally we become very sad. That's why I'm telling they are not sick, they are heart sick, heartbroken people. So if they are coming to us, we should give them first consolation as well as hope. We should our approach should be very gentle. But one thing we should know, be careful that if they are a natrium patient or a subadilla patient, finished. If we are consoling them, if it is a natrium patient, without telling or doing anything, he simply go out of our chamber within 3 to 5 minutes. If it is a subadilla patient, he will he or she will get to the spouses angry. If they will get angry to the spouses, why you brought me here and all, they will be murmuring. So be very careful. If it should not be, if they are, it is a natrium patient or subadilla patient, don't try to control them. Just tell them the truth. We will try our best to have the good result and all. We will just tell. In ancient as well as in modern times, infertility it is considered as a curse. In ancient, in our Purana, it is written, Putra means Pum Nama Magira Trayadedi Putraha. The person who is saving us from Pum named hell is called Putra. That means Putra or son or grandson. So everybody will be trying to get a child, no? So if they are not able to do that, they will be much depressed. So we should at least we should tell them that they have homeopathy has got immense power, and try to give them some testimonies we have got about the cases. Or naturally, they will be coming to us from anybody will be telling them that they are having child from our treatment. So hearing that or seeing that only, they will come to us. Anyhow, try them to control, and our approach should be gentle. The one thing we should know the difference between infertility and sterility. Infertility means apparent inability to conceive a child, but sterility is permanent inability to conceive a child. But in infertility, they will be having suspemia or absence of reproductive organs or Klinefelter syndrome. Klinefelter syndrome means the addition of one X chromosome, though they will be having low testosterone or the small penis and testes, etc. In female, they will be having the absence of reproductive organs like uterus, ovaries, etc. In that case, we should ask them to try for other methods like adoption, donor sperm method, or surrogate mother, or test tube baby. We should advise them. These things are not new. In Puranas also, the same thing had happened. See, Karna. Karna was an adopted child to that fish, the Dobby, Ratheya. He was called Ratheya because he was an adopted child. He got the child from accidentally they got, and they adopted him, and he was brought up by that Radha, that man's wife. So he is called Ratheya, and that is adoption. Then donor sperm. Donor sperms in Purana we have read what sage was there, Jambadatni. He was killed by a Kshatriya, by a king. His wife, seeing the dead body of that her husband, she bet on her chest 21 times. Then her son Parashurama saw this, and he killed all Kshatriyas of that kingdom 21 times. Even small Kshatriya boys were killed. Then that Vamsa will be destroyed, no? So the old ladies told the young ladies to bring beautiful intellectual Brahmins and to have babies. Then here the donor sperm also is proved. Then in Bible, one incident is there. Abraham, a man, the character is there. Abraham, his wife is Sarah. They got old. They were not having children. So that Sarah asked her servant Hegel to get dressed and go to her husband. She went to him and she got a child, and that child was taken by this Sarah, and she sent that Hegel home. So surrogated mother also is result. And even test tube babies are born. Gandhari and Kundi were sisters-in-law. Then they got pregnancy moreover at the same time. Gundi got delivered earlier than Gandhari. So Gandhari got angry. Then she bet her abdomen several times, and that the baby in the womb was delivered. That is prematurely it was delivered. So she called Vyasa said, and Vyasa came and asked Gandhari to bring 100 pots, and he divided the premature baby to 100 pieces and put in 100 pots with some medicinal plants. And the balance he put in 101st pot, and the 100 boys and 101 one girl was delivered. Here, that we also is born. But I will not advise them to do all these things, because nowadays, in my age, in olden age, Mada Pida Guru was Devam. But here in this area, in this in this state, children are having more that is attraction to money as well as freedom. They want freedom. They want money. Somehow or another, they want to become this one. Even biological mothers, biological sons are doing harm to their parents. So I will not advise them to adopt or have all these methods. Then, in infertility, 30% defect will be of male, 30% of female, and the 30% both of them, and the balance 10 will be without any cause. Here, if any cause is there, we can at least we can correct it. But without any cause, we could not do anything. In that time, I will advise them to go for a cure. Only both of them should go. See, I had a patient, Binu, from Calicut. I told him to go for a tour. Then he was having a joint family. Then I told him to go for a tour in that fertile period. Then one day he came here. He and his wife came. There was a lady, there was a girl of 19, 20 years old. Lady was there with them. And then after taking this case and all, they asked me to show the bathroom. Then I showed them. Then both of them are sitting here. Then I told her who had gone to bathroom. She told my niece, my sister's daughter. Then I asked, your sister also has come, no? Then Vinu is telling, no, only three of us are here. Then I asked in hotel, how will you stay? We will stay in 3-bedded hotel. Then I was, what I should tell them. I told them to have a change from that joint family. But here, that the 19, 20 years old girl is with them. How they can enjoy their life? So, advise them to go alone uh, in for this in that fertile period. Otherwise, if they could not go, ask them to change the bedroom. For the thing without reason, I am telling you, ask them to change the bedroom. Sometimes that itself causes some good result. Otherwise, if they cannot change the room, ask them to, hello, ask them to change the position of pot. If they are not having any spare room, ask them to change the position of pot. Or even that also is not possible. Ask them to change their position of lying. That itself may cause some good result. Otherwise, ask them to go for some Vrata or pilgrimage. See, have you heard that going to Velangani or Parani or Bhimapalli and all, they got child because changing the usual lifetime pattern, the production of good hormones will be there. So they will get good results. But one thing you should know, see, in that time, if we are asking them to go for the son and all, we should give anti-miasmatic treatment as well as constitutional treatments as well as organ remedy. And moreover, you should note the LMP of that patient. Otherwise, I had an incident. One lady, she was 48 years old, and the man was 52 years old. They came to me, and when they came to my this, she was the second day of their menstruation. Then I gave medicine, and I gave medicine until that. I had asked them their history, and up to that time, that lady only was treated. That man was not given any medicine. I had not taken any medicine. Then I asked them, why you are not taking? "No, I don't have any problem, doctor. Only she got problems and all." He was telling. Anyhow, I gave medicine, and the second time she got pregnancy. Then what medicine I had given? No, I had given Tuja. Why? The man after they are Christians in pre-marriage counseling, he was told by some doctor that the ovulation of the lady having normal menstruation 28 to 30 days, the ovulation will be on 13th, 14th, or 15th. So, up to that day, 19 years, they are married 19 years back, up to that day, they were having contact only during the 13th, 14th, and 15th day. All the other days they will not have. He is so that he is so adamant. He will tell, no, doctor has told only that day only we have to this have that sexual intercourse. Otherwise, the quality will be reduced and all. He was telling. Anyhow, I told them I had given him puja because the fixed idea he got. And Medorinum also I had given him because he was killing that insects and that what is that? Um, is that one animal is there? He used to, whenever he see the animal, he will pelt stone on them. That cruelty, seeing the cruelty, I had given Medorinum also to him, and I had given ashwagandha and all. And I told to have this when I goes after 5th or 6th day, after finishing the bleeding, you start, anyhow, the medicine worked, whether Suja worked or Medorna worked, I don't know, and Ashwagandha and all I had given. Anyhow, that a lady got pregnant, and he told, doctor, my wife has got pregnancy. Then I told, okay. Then she suddenly, he telephoned me. Then suddenly he stopped the telephone. Well, then I was telling why he was doing like this. He was not happily telling my the this one, the matter of pregnancy. Then I asked him, I asked my pharmacy, pharmacist, he was neighbor of my pharmacist. Then I told why Joy was not so happy telling that. Then pharmacist was telling that, no, doctor, Joy was telling that the pregnancy got not from homeopathic treatment, they got pregnancy from one Achan had one priest had told them that put his hand on her head and told that you are 3 months pregnant, it seems. It is because of that attendance, this one. At the same time, they have come to me on the second day of their menstruation that I have noted that. Anyhow, I took my letter pad and wrote, if it is Ambadi's child, I put that 9 days and 9 months and 7 days period. In between this period, the child will be born. If it is Achan's daughter, if son or daughter, he will be born 3 months earlier. Anyhow, it was somebody's daughter only. So you should note that LMP of the otherwise credit goes to Achan or anyone like that. Mhm. Then, see, usually these couples, when they are attending any marriage function or marriage or birthday party or any other function, then all the ladies, they will ask, no, see, you don't have children, why you are not doing anything and all they will be asking. If they are hearing that, they will feel that whether they are doing anything or not is in their hands. So they will start telling that, see, the couple who had married along with you or in that time or after that got children, why you are not trying for that and all, they will be asking. Then he will give all the numbers of that gynecologist or gynecologist or any doctors number and phone number and the details he will give. Even he will give the details of Ladavidya also. But suppose if they are telling, see, Amma, we are under the treatment of an homeopathic physician, finished. They will tell, see, you're trying homeopathy for such a big thing. See, the homeopathy, that sweetened tablet, even for small children for worm trouble and this fever and cold, you are giving medicine for this infertility. Why you are to wasting your time and all? They will tell. Suppose they will tell that I don't think you will have children. You are becoming old and you are becoming obese also, and like that, saying all these things, they will disappoint them also. If it is their fertile period finished after attending the function, they will come home and they will be starting finding fault with each other, and they will be lying in the bed back to back, and that fertile period will be over. So be very careful for that. In that time, I used to advise them that if anybody is asking you like this, why you are not having children, why are you not doing anything and all, if they are asking, you just tell. I am, we don't have plan to have a baby now because we have got more responsibility. We have to build house, we have to marry our sister, or we have to, our job is not, there's some problem is there in our job, the job and all, you should tell. And then if suppose if they are getting pregnancy within 1 or 2 months, these well-wishers will ask why you are telling that you are not ready to have pregnancy now. then you should tell, see, at that time I was not prepared. Now I prepared. I got pregnancy also. Have you got any particular this thing to tell? If you are asking them, they will not ask the same question to anybody else. So I will ask them to tell like that. Don't get disappointed. I will tell them. Usually the ladies, they will think that they are disgraced. They are not blessed. And they will be thinking herself that she is Apasagunam. They will think. And the male will be thinking that they are discredited. They could not prove their masculinity. We should be very careful to give hope and courage to them. Then here we can try digitalis, especially if they are having any cardiac problems, any chest pain or difficulty of breathing or anything like that relating to this one. Digitalis will work well, very very well. See, I told you, no, in sterility, absence of some reproductive organs. See, if to youngsters, I have to tell that, see, if they are coming, don't be hesitated to do physical examination, because I had this one years back. I was only in my 30s. Then my father's classmate's son came to me, having this infertility complaint. Then I gave 3 months treatment, and without any result. Then I sent that man to this one, male nephrologist near my clinic. I know him very well. I sent him to have physical examination. Then after physical examination, he told, I will tell Ambadi the result. You can go. Then he telephoned me and told me that Rama, that a man is not having testicles. I was, see, no, I felt bad, because 3 months without the physical examination, I have given the medicine, and see what I have done. So, see, youngsters, you should not be hesitated to do physical examination. Okay. When they come to us, we should ask them. See, if it is a fever complaint, I will ask you, have you got a throat pain, body pain, or headache, and all, I will ask you. But here, I want to know the details of your sexual characters. You should not be hesitated to answer my questions. You should first itself, you should tell them. Then ask them what this frequency of coition, or about their erection, about their this one sexual this one, every details of this one. Try to get the otherwise, because see, some children, I told you, the man, he was having the goes only on 13th, 14th, and 15th. Actually, what happens, two ovaries, one ovum will be released after on 14th. Both ovums ovaries will have been these follicles. One ovum will be one follicle will be ruptured, and ovum will be released. And the other one, it is, see, if it is 7 millimeter, then gradually that this one will grow very fast, and sometimes the ovum will be the mature, and it will be released by seventh or eighth day. Because I had a patient. She was she was having this aged patient, CB engineer, and his wife. She was having her menstruation, and on fifth or sixth day, they had the sexual intercourse. Then that day that next day morning, they got a phone that their mother is ill. In that they are in Calicut. She is in the couple is in Ernakulam. They went there. Sixth day they went there. Unfortunately, the mother died, and she was kept there. And the man came back after 41 days. He went there and brought her back. After that, when she came, she told, this month I didn't get my menses. Then I told them to go and to check the pregnancy. Then pregnancy was positive. Actually, they had intercourse on fifth or sixth day only. Then we had got one pathologist here, Dr. Chitra. She used to tell. See, don't tell them that on 13th or 14th is not really. The ovulation can be done on from after the stoppage of menstrues. Any day the ovulation can be done. It can be uh, occurred. So ask them not to see the days. I used to tell them that just like lottery, we have if we want to get lottery prize, we have to take lottery like that. You take, you have this one, then naturally the result will come. Then one thing is that I used to tell you take lottery and result will come. Then when they come next visit, I will ask them, what about, are you taking lottery? Then, oh yes, doctor, they will tell. One day, he belongs to Tamil, Madras. He knows Tamil only. I know Tamil. I told them to, like this, you take lottery and all, I told. Then after two or three, second or third visit, they came very, very happily. Then I thought they will be, she will be pregnant. And then she was telling, give, like that, she was telling. Then the man stood from my this one, and he put some notes on the mud table. Then I thought, why this man is putting notes on the table? Why he is not that taking the showing me the card? Then he told, see, doctor, from that day onwards, I used to take daily. We will take two lotteries, one in our name and one in your name. Yesterday, in the lottery in your name, got price of 5,000 rupees. After the reduction, I have got a 4,800 rupees. I was putting the hand on my head. My God, all these patients to whom I used to tell take lottery, whether they are getting my medicine and buying lottery and putting it under the pillow and sleeping. I was wondering. Anyhow, and I tried ask them to have frequent coition at least 3 to 5 times a week per week. Minimum 3 to 5 times they should have this one because the sperm will be alive in the vagina 3 to 5 days. You know, all of you know, I know. But the ovum will be alive only 24 days, 24 hours. So when the ovum is matured, the sperm should be there. That's why ask them to have intercourse at least once in 2 days. Then now I told the infertility is the apparent inability to have pregnancy after living a life unprotected regular intercourse. Unprotected means, see, I had a patient, she was a teacher. She has got his husband, in-law, father-in-law, father-in-laws, and their parents also was there. So she is very beautiful and she was very poor also. Then this the man's very nearby, just opposite is their school. Then the boy saw her and he liked him, liked her, and she married. Then she told, they had told not to go to school. But she told, no, I want a job. I will not quit my job. Then they told, see, when you get a child, you have to quit the job. So what she was doing, no, she used to take, he was in rig. He will be coming once in 3 months only. Then she was taking or contraceptive pills on when he comes. No, if you was telling, no, if you was not telling this to anybody, then when I took the case, she revealed me the fact. Then I told you should stop this because suppose if you are not having the baby, if they are finding fault with that, and if they are doing anything like that, you will be in trouble. So to not do like this. And I told her, and I told. See, in your nearby your school, no, you can appoint a servant, and you try to have a baby like that. And I told, so we should be very some ladies because if she was using contraceptive pills. We should get the conference. Then only they will reveal the secret to us. For that, this one, no, in that case, for that abstinence, he was in the rig, no, they got one boy, he was in a rig. For abstinence, I had given him phosphorus, kali brome, ashwagandha, and neophyllum. For that girl, I had given pulsat, sepia, sepia, then Helonius, and I think I had given Barax, I had given. Mm, he got child. Then see, I used to tell them, see, if they are, some doctors will be telling, see, if they are having an abortion or 1 or 2 abortions for usual secondary infertility, I won't tell like that. It's that if they are having a pregnancy and if if it got aborted, it will be proved that they are fecundable, but fecundability is not this proved. If they are having a live baby only, the fecundity will be reproved, and then only we can tell them that fecundable. No? See, in this one, no, in olden days, the infertility was not so much, but here in nowadays it is more because see we are easily influenced by the foreign culture, that late night dinner, then there's fast food, broiler chicken, all these things. Because of all this, and especially the life pattern, most of them will be doing work in the night or a late night sleep. All these things influence their fecundability. Then we should ask them to try to correct them, at least that fast food, this one, the broiler chicken, and we should ask them to reduce. We could not ask them to stop, but ask them to reduce. Then the same like that, they have got this dress pattern also. See, nowadays they are having tight pants and all. If they are having tight pants and all, it affects these the testicles, in for male. We should ask them to do like the necessary thing. 15 minutes more. Shall I give you some tips?
Yes, ma'am.
Yes. Yes, now.
Okay, wait, just a minute. See, by appearance, we can see the personality of it. See, usually phosphorus will be affectionate, whether male or female. They will be affectionate. Then we can very well think of phosphorus. Then lycopodium, they are very ambitious. We can this lycopodium and natamor, they are brooding. Always they will be brooding only. Then cocculus, they are contented. Calicarb, duty bound. Pratina, egoistic. Insecurity, calcarea carb, but insecurity in for infertility, sepia works more than calcarea carb. Lachesis, very jealous. Yielding, pulsatilla. Belladonna, very beautiful. Pyramid, flushing. Alumina, confused. Tarantula, dancing girls. Then Ignatia, hysterical. Sepia, indifferent. Oromet, very responsible. When we take the case now, we should see their temperament also. Temperament means the physical organization peculiar to the individual, which influences one's thought, action, and metabolic processes and a general view of life. Sanguine temperament, they will be extrovert, talker, optimistic. They will be having fresh complexion as well as light hair and eyes. They will be having good digestion and all, and they get very easily anger. But it won't long last. Just like a water bubble, it will burst. They will get easily angered, but it will be soon gone. Porphyria, Parampos, Lachesis, Phosphorus. Sanguine temperament. If it is choleric temperament, extrovert, doer, optimistic, easily provoked and irritable, but hard to please. Very, very hard to please. Bryolia, Lycopodium, Naxomica, Baratrum alba. Then if they are melancholic, introvert, thinker, pessimist, they will be talented, faithful, and a perfectionist. Natramore, Ignatia, Oromet. And phlegmatic. Sanguine will be having high potency, but melancholic will be having low potency. Phlegmatic, introvert, watcher, pessimist, they will be friendly, contented, and peaceful. They will be like a couch potatoes. You know, couch potatoes, calm, easygoing, leading a well-balanced life. This one, they will be enjoying watching TV, eating groundnut. They will be watching TV. That is why they are called the couch potatoes, phlegmatic. Calcarea carp, Baraita carp, pulsatilla. Nervous, introvert, anxious, pessimist. They take a lot of undue stress. Argentinitricum, Gelsemium, Arsalbin. Then we should see the miasm also. Psoric or psychotic or syphilitic or tuberculum. Psoric, painful or irregular periods for ladies. Leukorrhea, the discharge will be mild, not irritating. Then weakness of sexual organs, excessive sexual discharge, vaginal polyp, and in psoric males, night pollution will be more seen. Psychotic, concentration on sexual organs, acrid leukorrhea with a fish brain like smell, infertility, pruritus vulvae, strain of the menstrual blood is difficult to wash, mental weakness during leukorrhea. If it is mental weakness with leukorrhea, psychotic. If it is physical weakness, it is tuberculosis. In male, hydrocele, orchitis, ovarian cyst. Syphilitic, impotency, CA uterus, CA penis. Offensive order of leukorrhea, which can be drawn like a long thread. Menorrhagia, recurrent abortion, or stillbirth, and in male, azoospermia. That is syphilitic. Tubercular, spermatoria and masturbation, emission of semen during defecation or urination. These tubercular patients will be having all complaints during the menstruation. Then leukorrhea before and after menses, with weakness after menses. Leukorrhea, tubercular. So
It's raining here. That's the reason why the network is doing such harm to our sessions.
can I stop?
No, yes, you can talk. You want to stop? Yes. Yes. If you want to conclude, then we can conclude. And you can have another session later.
Okay.
Or we can go with some discussion.
Okay.
Let us
Shanda is there? Shanda is there?
let me check. I'm inviting Dr. Asha Varghese to say a few words. Please unmute.
Yeah, good evening, sir. Good evening, everybody. Thank you so much, Mama. It was a wonderful, class. And I'm not able to see the video.
Yes, sir.
Some network problem.
Okay. Yeah. Hello?
Yes.
Yeah. And she seems pretty tired after the long journey and everything. Then sir, I think, she's taken a class, I think probably last minute notice probably, right?
Yes.
Anyways, wonderful class, Mama. Thank you so much. On behalf of IFPH and the whole team, I extend a warm thanks to you, Ma.
No, we have some more means.
Okay. Just a few words, is it?
Yes.
Okay.
Yes,
As usual, wonderful class, Anna sir.
Yes, we can invite.
If we are having antibody disorder, antibody should be less than 200 units. No, if it is serum sperm cervical antibody, diphtherium strium will work very wonderfully. Diphtherium strium.
Diphtherium. Okay.
This I got from this Hari Kumar.
Have you ever tried it, Paul?
Yeah, I had tried and I got results.
Okay.
That's why I have written. Serum antibody, echinacea and diphtherium. Sperm antibody, echinacea, vanadium, selenium, and sanicula. This I have got.
How it can be given, whether in together?
Diphtherium CM only 2 doses. Echinacea tincture we can give, and diphtherium for sperm antibody, echinacea tincture and diphtherium CM.
Okay. Now I'm inviting Dr. Sheila to say a few words.
Ma'am, it is a wonderful section, ma'am, but we need some more clarification because in each cases, what is the potency usually you are using? So we want to know that. And tinctures you are using for which tinctures you are using for in female infertility? All these we want to know. Maybe it is already the class was in before already you said like that. I don't know because I am very new to this session. That's why. So I want to know which tinctures usually we are using for the infertility cases in female.
Female, alfalfa, this Elatrice, Ashoka, Ashwagandha. Ashwagandha we can use for male as well as female. Then Agnes, Agnes for male and female we can use. Then that
Uh,
is
so,
Viburnum we can use.
so we can have a session on how we can use this medicine and what are the
I will make.
and
I have got a PPT, and my the laptop is not working. That's the problem. Otherwise, I would have. I
we
have
can
got
do
a
one thing.
PPT.
We can do one thing. You can share it to us, and we will share from our side. No problem.
Okay.
So that
Okay.
we can arrange such a session in the coming weeks. So
Okay. Not
okay.
not
So particularly giving the importance of how one can use these things for all these things, and that's
anyhow, Sheila, we should
Yes.
give the constitution medicine. We should give sulfur, calcarea, carbon, lycopodium, orconium, maxol, like that. We should give. Then that is higher potency. Tennum. Usually, I used to give. I and my friend Dr. Chanda used to give constitution medicine in higher potency. Then
Okay.
organ remedies we will give testis 3x or ovaries 3x or natrum 3x. All these things we really lecithin, beta vulgaris and all we used to give. Then
we,
ashwagandha and all.
we shall arrange a session next week itself so that those who want to know about all this
Not
you can.
not next week, Ganesh. I am so tired.
No,
After
no. As and we
27
are,
days,
as
27,
and when you are healthy and well, we can arrange. No problem.
27 days pilgrimage.
Okay.
27 days.
Okay, that's good. That's good. And now we can invite Dr. Ramadevi also to say a few words, and then you can say what to thanks to the session also.
Thank you. Thank you, Dr. Dhaneji, and congratulations to respected Dr. RAMADEVI Ambadhi for the excellent and lightning webinar presentation, management of infertility. Lot of medicine describe the madam according to role of miasmatic, sora, psychotic, syphilitic, and tuberculum case of infertility. Sora, functional hormonal disturbance, delayed conception due to weakness. Psychotic, PCOC, OS, fibroid, ovarian tumor, ovarian cyst, thick discharge, etc. Syphilitic, congenital, repeated abortion, etc. So, very thanks, RAMADEVI Ambadhi. Thank you. Behalf of IFPH, whole team, very thanks. Again, presentation. Thank you.
Thank you, sir. So, shall I conclude, sir? Ganesh, sir?
Yes.
Thank you, everyone, once again for joining us in this webinar series. And a big thanks to Dr. Ambadhi for having here with us and sharing everything that she could, even though she was tired after her pilgrimage. Thank you, ma'am. Thank you, everyone.
Thank you.
Deep.
Thank you, Maria. Thank you a lot. Thank you, all.
Okay. Tomorrow we will have a session from Dr. Rexis Visvara. So hope all of you will join tomorrow. He is an associate professor from Rajkot Homeopathic Medical College. And over to Dr. Mariamma Joan tomorrow in the Malayalam session.